there are several different terms that some people might think are that any of these terms can be used and they refer to the same thing when they're talking about complementary and alternative medicine. But it sounds like you have a perspective that each of these terms is a little different. Can you tell us a little bit about some of the terms that are used?
Sure. The terms complementary, alternative, integrative medicine, and then holistic. So let's talk about those. And with complementary medicine, we're talking about therapies, practices, or providers that individuals will see that they're using in combination with their what we call conventional health care. So conventional health care is sometimes misconstrued as traditional health care, so you don't want to mix up the terms. Conventional is really what you go to your doctor for, so your primary care doctor, your nurse practitioner, your hospital, your ER. With alternative medicines or alternative medicine systems, we have systems of care. And some of the ones that we've mentioned before are things like Ayurvedic medicine, traditional Chinese medicine, where they're actually, or homeopathic medicine, where they're actually whole systems, specific ways, and they'll oftentimes include herbs or practices. You know, for example, yoga comes out of Ayurvedic medicine, and some of your acupuncture comes out of traditional Chinese medicine. And some of these have been studied a long time or not researched, depending upon availability of funds, etc. So that would be your alternative medicine systems. We also use the word alternative kind of freely to talk about people choosing alternative therapies instead of their conventional ones. So if a patient decides to forego chemotherapy, for example, and we've had movie stars that have done that, and they decide to go to Mexico and get a supplement of some sort, that would be considered alternative medicine. Integrative is really the word that covers a lot of this now, because that's combining the best of both worlds. So you would have therapies that are from different systems of care combined with your conventional care. And you see that with Beaumont's Integrative Medicine Center and Henry Ford's Integrative Medicine Center.
Okay.
Holistic's the last one, a little bit about that, and that is the body, mind, spirit. And so many of these therapies incorporate aspects from all the body, the mind, and the spirit.
Okay.
So it's holistic.